Hey guys, hi, this is Ami here, and today will be today we are doing a live with Dr. Isha and Dr. Ekta, and we'll be learning two things. One is how to take care of toddlers' oral health, and also how to strategize a business, specifically a dental business. So all you moms and budding dentists out there, this is for you. So I think yes, Ekta has.
Hello. Hi, Ami.
Hi Ekta. Hi. How are you?
I'm doing well. How are you?
I'm doing good. So yes, I think we are waiting for Dr. Isha.
Yes,
Yes.
she should be
So how's your
joining
day been
in.
so far?
Very good. Had the kids' school PTM today, so we just finished that quickly. And now Diwali vacation, so we are all excited to have the holidays. How about you?
Yeah.
How's your day been so far?
Good, good. Going good. I'm in the office. I'm really excited for this chat.
Yes, looking forward to it.
Yeah. This is
Has Isha? Yeah, Isha has joined now.
yeah.
She's joined from the clinic handle.
This uh, Hi
So
Isha,
excited
can you
about
just
Diwali?
request? Oh yes. Yeah, I think after 22nd, 4 days, no work. Just,
Yes, yes. Everybody's looking forward to that.
Yeah, I think Isha, please request to join the video.
I think she's joined, but acha, video is not on.
Yeah, I just need her to request because
Okay, okay. And how old is your little one?
so my little one is 21 month old.
Oh, so tiny. Lovely.
Yeah, so I have a lot of questions for you guys.
I'm
How to,
sure, I'm
take
sure.
care of his teeth. Yeah.
Yes, yes. Definitely, definitely.
Just a
And what's
second.
his
I
name?
think I'll just. His name is Shlok.
Shlok. Okay.
Yeah.
My kids are a lot older now. My son is 14, my daughter is 11. So we
Oh,
are
wow.
into teenagers.
Yeah. Just a second. I think there's some problem. Just a second. Yeah.
Is Isha able to hear us or not?
I have, yeah. I think I've invited her. She
Okay.
will join
Yeah,
us.
there
Yeah.
she is. Lovely.
Yeah.
Hello.
Hi.
Hi.
Is it audible
Hi,
now?
Isha. Yes, it's audible. We are
Yes.
not able to see
Yes.
you properly.
Okay, now is it better?
Yes, it's fine now. Yes.
Yeah,
Can you see
hi.
her, Ami?
No, I'm not.
Oh,
Ekta, you are able to see her properly?
yes, I can see Isha.
Okay, okay. Then I think some glitch from my side.
Okay.
Uh, okay. Yeah.
Okay,
So,
so
hi guys.
Hi, how have you been?
I'm good. So, Isha, you are in the clinic.
Yes, I'm in the clinic.
Okay. So, thank you first, both of you, for taking out the time and talking to us. So, this session, basically, this live will be in two parts. One is, everything which, we require to know about our kids' oral health. And the second will be something for the entrepreneurs out here. about what are your strategies and what is the scope for dental business and what is new. So, yes.
Yeah.
So, I think we should start with the first part.
Yes.
So, Dr. Ekta and Dr. Isha. So, my kid is 21 months old, and I would like to the very basic question, which is the best toothbrush and toothpaste to use? Let's start with the
Okay.
basics.
The
Go ahead,
most
Isha. I'll
common
let you answer
question.
all the kid questions because Dr. Isha is our pediatric dentist in our
Yeah.
team,
Okay.
and she specializes in taking wonderful care of our children. So I will let Isha answer all the child-related questions.
Thank you. Thank you for that introduction. And yeah, this is the most common question asked by all the parents. Okay. What I would suggest is please start brushing your child's tooth as soon as you see the first tooth erupting. Okay, you don't have to wait for all the teeth to come in the mouth and then start brushing. So start brushing as soon as you see the first tooth. And there are
Okay.
age-specified toothbrushes available. So to start with, you start with a baby training toothbrush or a finger brush up till 1 or 2 years of age. And post that, you get toothbrushes with age specified, which is written as 2 to 4 years of age, 4 to 6 years of age, and 6 to 9 years of age in a market that is
Okay.
available. Okay, so any company toothbrush you can use with that age specification. And
Okay. And no
toothpaste,
specific brand.
no specific brand. All the brands have soft bristle brush only. There are lots. There is Mimi, First Cry, BB, Oral-B, Colgate. All of them have it. Just the age
Okay.
specification should be good enough.
Okay.
And regarding the toothpaste, again, to start with, when you're training your child to use the toothpaste, you can use a non-fluoridated toothpaste. Okay, that is only for the
Okay.
initial 2 to 3 months for the child to get used to the toothpaste. Because again, ingesting a lot of fluoride is going to be a problem. So to train the child for that toothpaste flavor, got to use a non-fluoridated toothpaste. And immediately after 2 to 3 months, once the brushing is in routine, start with a fluoridated toothpaste. Check for a toothpaste which
Okay.
says 500 ppm to 1000 ppm of fluoride
All right.
for children.
So I think that is very important to note. Uh,
Yes.
500 to 1000 ppm.
Yeah.
Okay.
The new recommendation from
Yes.
the ADA, like the American Association of Dentistry, Pediatric Dentistry, AAPD, says that 1000
Hmm.
ppm of fluoride is recommended for children.
Okay.
And the quantity of the toothpaste is supposed to be just a rice grain smear, just the size of a rice grain.
Yeah.
So that is
As
very important.
against what is shown in the advertisements.
Yeah, the entire
Yeah,
tooth bristle, that's
they
just a
really
marketing
fill
gimmick.
the toothbrush. Yeah, because they
That's for
really
you to
fill the
buy more
toothbrush.
toothpaste.
Yes, exactly. That's so bad for you.
So
You must
it's
always use
just a
minimum
rice grain
quantity.
size for children.
Okay. All right. So the next question would be, so specifically me, it's very difficult for me to rinse Shlok's mouth.
Hmm.
How do we do that? So he is like, there's obviously that risk of getting bitten, but other than that also, uh, it's so obviously you talk to them, you train them, but it's still difficult. They are so young. So can you please just like how to do that?
Okay, if I may know, how old is Shlok?
It's 21 months.
Okay. Okay, so right now what is going to happen is he's not going to understand how to rinse. Okay, that understanding of rinsing and spitting out of water is going to happen only once he reaches about 3 to 4 years of age. So till then, what you can
Yes.
do is stand behind him. Don't stand in front of him and clean the mouth, because then of course you're going to be bitten. So stand behind,
Yeah.
in front of the mirror, stand behind the child. Ask him to open the mouth.
Okay.
You can use a wet gauze piece, okay, or even a
Hmm.
toothbrush bristle is good enough
Okay.
to just clean the tongue, brush the tongue off. And for
Okay.
rinsing, you can give a sip of water and then you do what he's supposed to imitate you. So you take that sip of water in your
Okay.
mouth, show him, see, I'm doing like that. Okay, and then he
All
may
right.
imitate you or he may gulp it down. So give them drinking water,
Okay.
1, 1, 2, 2 sips in between. And to clean the
Okay.
tongue, use the brush bristles only to brush off.
Yeah.
So that is going to be good. Stand behind and do it so the convenience and the comfort is better.
Okay. So I do the tongue cleaning as you said. The rinsing I use the injection because I actually didn't know. So that is what I do. But I'll do this from
Yeah,
now.
so
Yeah.
if
Thank
you're
you so
using
much.
injection, if you're using that syringe, okay, you can just put
Yeah.
that water in the mouth and show him what he's supposed to do. He may not grasp that
Yeah.
in one go. You may have to do it
Yeah.
continuously for 6 months. Okay, and
Yeah.
once he
It's a
sees you
process.
doing it, yes, and once he sees you doing it, so initial few months he may just gulp it down. That's fine. So give him drinking water. But eventually, when he sees
Okay.
you, he will imitate you. So he'll learn that.
Yes. Thank you. Thank you. Ikta, I'm actually not able to see you properly. I'll just let's see what I can do. Just
Am
a
I not
second.
visible?
No, no, you are. Sorry, Isha, you are not visible. Sorry.
Oh, okay.
I I don't know. I mean, I can see
I mean,
everybody
I can
clearly.
see,
Sorry.
yeah, even I can see you very clearly, Isha. So I don't know.
Yeah,
Some
because
network glitch.
at this, no, I
Yeah.
can see Ekta properly. The thing is, otherwise it will not show properly on the video. Acha,
Hmm.
Seema is saying all are visible. Okay, I think
Yeah, she
then we'll just
just,
go ahead. Okay, okay.
yeah, yeah.
All right, so next question. Yeah, when should they start brushing on their own?
Okay, that's good. Okay, generally children want to hold the toothbrush as soon as they, see you brushing. They also want that toothbrush. No, I'll do it on my own because that
Yeah.
independency in them starts coming by the age of 3, 4 years. So they want to do it all
Hmm.
by themselves. Okay, but what happens is they have not developed the manual dexterity. So manual dexterity
Hmm.
means the grasp to hold this toothbrush. Okay,
Yeah.
that grasping power is not there until and unless they turn 7 years of age. And how you know
Okay.
the manual dexterity is attained? When they can either button their own clothes up, or when they can learn to tie their shoelaces, or when they can,
Okay.
tear the chapati on their own with one hand,
Okay.
or also when they can learn how to eat rice and dal or rice and vegetable with
By
hands.
hand.
Okay, so
Okay.
these are all the
Interesting.
these are all the things that you will get to know that the child has developed the manual dexterity, which is generally by 7 or 8 years of age. When that
All
happens,
right.
the child can start brushing on their own. Up till then,
Okay.
strict brushing by parents at least till 5 or 6 years of age. After that, if the child is insisting too much to brush on their own, they can, but under strict supervision of the parents or the guardian, not on their own.
Yeah.
Because of that
Of
grasping thing,
course.
they may just brush the front teeth. But this brush
Yeah.
is
Yeah.
not going to go till the end. So
True.
always the back teeth are left behind. So that is why it's
Yeah.
recommended that
So
it's always done under supervision, and they start brushing when they turn 7.
So yeah, we as parents need to be very vigilant about this.
Yeah,
Yeah.
yes. Even if guardians are
Oh,
supervising, it is to be instructed to them, because I understand parents are working or they may not be full time around, when the child is 5 to 8 years of age or when the child has started going to school. It's not possible to run behind them every time. But at least out
hmm.
of the 2 times when they brush morning and night, one time has to be supervised.
Okay. Noted.
Also, Isha, you might want to stress on the fact that the children must brush at night, no matter what,
Yeah.
because that's usually the most skipped time of brushing.
Yes, yes, yes. So that is a habit to be
Good.
inculcated from day one of when you start brushing. So that one tooth, when
Yeah.
it erupts, no, when you start brushing, from then the habit has to be put morning, night, morning, night. Just like how you would put the habit for the child to have a bath, to use the
Yeah.
washroom, to finish their
Use the
daily
washroom.
routine, to have
Exactly.
the
Yes,
meals.
yes.
Okay, so brushing is also a part of the routine. It is as same
Okay.
as having a bath, using the washroom, having their meals. So that routine, if it is
Okay.
set and trained in their head from day one, they will never forget and they'll never skip.
Okay.
because it's as
I
good as
think
you
a
wouldn't
lot of us
you
miss this.
yeah.
Yeah.
So you wouldn't forget to have a
Yeah.
bath or have a meal. So
No, but
brushing
even as
has to be a
adults,
Yes.
part of it.
majority of the
So
adults
true.
tell us, right, that we don't brush at night.
Yeah.
So
Yeah,
many
yeah, yeah.
adults tell us that too. And
Yeah.
then you feel, okay, no, you have to do it. And then that's how your children will also see you doing it. So they will do it too.
Yes. Yes. And
True,
another
true,
thing
true.
is children always imitate. So once the parents are
Right.
doing it, they will imitate and do it.
Yeah. So we have a question. What should be the size of the brush? I think she's already gone through this. So there are age-specific brushes available in the
Yes.
market. So
Yes.
according to that, I think the size of the brush is according to
Yeah.
the size of the age of the child. So
Yeah.
yeah.
Yeah. Yeah. But one more thing I would like to say in this is always check for this bristle head. Okay. Always the bristle
Okay.
head is going to cover only 2 to 3 teeth. If it is covering more
All right.
than that teeth for your child, the brush head is a bigger size.
All
Okay,
right.
so these are available. See, this is the
Yes,
smallest one.
definitely.
Okay, this is a little size bigger.
Mm.
So these are
All
age
right.
specific. This is for a 2 to 4 year of age. This is for a little older, 4 to 6 years of age. And this is for even older children than 7 years of age. So always check for
Okay.
this size, this width from the head till the end of the bristles, whether it is covering 2 to 3 teeth for your child.
All right. So the next is when should be the first dental visit per child?
First dental visit should be ideally as soon as the first tooth erupts.
Okay.
Okay, as soon as the first tooth erupts is the first visit, or if not, then at least by the first year of the child, the first 1 year, just before their first birthday. Okay, so when the child is
Okay.
around 1 year of age is the first dental visit, because that time we examine the jaw size, the tongue. Okay, there are some muscles inside which are attached to the tongue and the cheeks. So we check for
Mhm.
all of those muscles whether they are in proper shape, form. Is it hindering the speech?
Okay.
Is it restricting the tongue movement? So all that is checked
Okay.
by that 1 year of age, and also by that time, few teeth would have been erupted. About at least 4 teeth would have been erupted. So we get to know whether
Okay.
the teeth are erupting in the proper.
All right.
And
Very interesting because
most importantly, those are the time when the teeth have started erupting. Okay, by 8 to 12 months, the
yeah.
teeth start erupting. So we can actually guide you on how to clean it, how when to start brushing, what toothpaste to use, what toothbrush to use. All these queries are educated to the parents at that time.
Okay. So I think it's very important because I yet have not gone to a dentist.
Yeah.
So I will.
Yes. So that's why
Yes.
that awareness is very, very important.
Yes. So I
It's
did
very
have a word with
important.
my dentist. He's like, you should come, but I have actually not gone because everything seems fine. But yeah, I will. I definitely will.
So unfortunately, that's the problem. Everybody waits till they have pain, and then it's sometimes a little too late for us to do preventive work. And we
Yes.
catch
Yeah.
things sooner if we check you regularly. So a small cavity can be caught at that small cavity size versus if you wait till it pains, it's already a big cavity. Sometimes it's already a root canal. And then the patients start wondering, Are, I didn't have pain and now you're saying so much. Well, you've not come to us for so many years.
Yeah.
So many things went undetected. And then once they get bigger,
Yeah.
they start hurting.
Yeah.
That's the thing.
So I
So
think
we
for kids,
highly
it's
recommend
much better. Yeah. Also,
as
I
much
feel
for
if
adults. I wouldn't say just for kids. I think it's as much for adults.
Yeah.
yeah,
One
yeah,
tends to take their
definitely.
children for everything, but one tends to neglect themselves, especially as us, as mothers. It's a very natural thing for all of us to first make sure the children are okay, and then we will worry about ourselves. I
Yeah.
think one should not do that. It's our
Yeah.
health is equally important.
True. Also, for kids, when you take them regularly, the fear of dentists,
Yes.
it reduces,
Absolutely.
because people are generally very afraid of dentists. So,
Absolutely.
yeah.
Absolutely.
Yes.
So
The
one
fear
last question for
inculcates
this.
the fear
Yes.
inculcates when the child is brought to the dentist in pain. So when the child is already brought in pain, we have to treat at that time. So the fear is that I already have pain, the dentist also gave me pain, because we don't have an option but to treat that child at that time. So that fear is psychological, and that starts developing for
Yeah.
the dentist at that time. So that's why you get a child from the initial years of their age, initial years of their life, they are going to get accustomed to the atmosphere around, and then it's not going to be fearful for them.
Also, they are very friendly visits. The first visits to the dentist are very friendly because we just check, we will just play around with them, we will
It's a
joke with
play
them.
date.
So they are very happy. And that makes it a very positive reinforcement for them. Every time they come, they look forward to it, that, oh, today I'm going to get a little gift from Dr. Isha. Today she's going to play with me. She's going to make me draw something. So it becomes a fun thing for them rather than coming. And I've also noticed, unfortunately, a lot of parents try to scare the children by saying, okay, if you don't brush, we'll take you to the doctor and they'll give you an injection and they will
Oh,
hurt you. So unfortunately, doctors are also labeled as little villains in their lives, and they get scared because of that also. A lot of things
Yeah.
starts at home, so it's
yeah. That's
important
very
to bring
unfortunate.
them. Yeah, but I've seen it so much that it bothers me. I always tell the parents, please don't scare your children like this. And that's how the fear develops. That's why they never go, they never go.
Yeah.
For years they don't go, so it's just a vicious cycle.
Yeah.
Yeah.
So the last question is, what kind of mouthwash should you use for a child, or should you not? Like whatever.
Mouthwash, see if the oral care routine for anybody, child or the adult, the oral care routine is brush, floss, rinse. Okay?
Okay.
Brush twice a day, floss once regularly, and rinse your mouth with normal plain water.
Okay. So there's a mouthwash.
Okay? Mouthwash is not in the oral care routine until and unless it is specified by the dentist or a professional. You just
Okay.
don't go over the counter, buy a mouthwash, and start using it, because generally the mentality is, I'm not brushed today, I'll just use a mouth rinse and I'm going to feel good and my teeth are clean.
Yes.
Oh
Okay, it
God.
doesn't work like
Man.
that. Yeah, we've
Yeah.
heard
Yeah.
this from so many people coming to
Yes.
us saying, okay, I just used a mouthwash, I didn't brush. Or probably they're traveling
Um,
and only mouthwash is used. So that's why
okay.
mouthwash is strictly prescribed only by the professional if required. For children,
Yeah.
I wouldn't recommend a mouthwash until and unless a pediatric dentist tells them or supervises, because that is also
Oh.
for a specific time for a particular reason. Okay,
Okay.
and there
Yeah.
are a
Please. I
lot of
think
mouthwashes available
very
in the market.
important.
Yeah, and there are a
Yeah.
lot of different mouthwashes available in the market. So they are for some particular and specific reasons. We cannot just pick
Okay.
up whatever we like or whatever color we like or whatever flavor we like and we use it. It's not that way. So for children,
Mhm.
brush twice regularly every day without fail. Flossing is as important as brushing for children also. So flossing
Okay.
once every day and rinsing after having every meal. After every meal, brushing
Okay.
is not important. They just need to swish their mouth, rinse, or gargle. So that is going to give them a good oral care routine.
Okay. Thank you so much, Dr. Isha. I mean, I think you busted a lot of myths. So now to a second part, that is your journey as an entrepreneur. Please tell us about your clinic, about your personal journeys. We would really like to know about the entire dentist business. And yeah,
Yes.
please share your journey
So
with us.
sure, sure. So, I'm Dr. Ekta, and I'm associated with Integrated Dental Concepts in Juhu, Mumbai. Basically, we are a relatively newer clinic here in Juhu. I was earlier working in the US for about 12 years. I've done my master's there at NYU, and I've learned a lot of advanced technologies such as Invisalign, implants, laser dentistry, etc. And in about 2012, I decided to come back to India. So the whole purpose was to start my entrepreneurial journey here in Mumbai. I started first at Kolaba with my family practice, and then eventually we moved to Juhu with a as a multi-specialty dental office where I have Dr. Isha as our pediatric dentist, Dr. Rohan is our orthodontist. Where I'm doing mostly general dentistry, cosmetic dentistry, implants, and I specialize in laser dentistry as well. So we decided to build a very state of the art, high end, multi specialty clinic together, and we work as a team. So it's really wonderful to have all these doctors, and it's been a great journey so far.
Amazing.
Yes.
So, Dr. Isha, would you like to say something?
Okay. For me, okay, to be honest, I was really not into kids before. It was only dentistry that I wanted to do, general dentistry. But then, of course, eventually, over a period of time, pediatric dentistry, like once I was in my dental studies, in my initial
Hmm.
dental graduation, in my final year, I developed some liking for kids. Otherwise, I used to always run away from kids. Okay, I do not have so much of patience to deal with kids earlier. But then in my
Well, you
journey
are
of
amazing,
MBS,
Isha. It doesn't look like that at all. You are so good with the
yeah,
kids.
so that has evolved for me. And trust me, now I've reached a point wherein I love to treat kids. So a kid coming to me and just going back with a smile on the face is that just makes my day. So for me,
Wow.
that evolving of not having patience at all with kids to loving to have kids around me at work has been a journey. So more than giving you the entrepreneurship journey, I would give my journey as not dealing with kids to loving kids around.
Wow, that's very impressive actually. It's not easy.
Yeah.
It's really easy. I mean, the
Yeah.
tantrums and they are so scared at first and
That's that's the bad part of it. I mean, a negative part
yeah.
of it, okay, tantrums and all. But something which overpowers that is when the kid comes in, the stories they tell you, the creativity that
Hmm.
they have, the
Yeah,
imagination what they have, their way of talking and conversing with you. Of course, we have to go down to their level to, talk to
mm,
them, listen to them. They love to be heard. So on the dental
Yeah.
chair also, you got to be patient for them, for us to hear them out. So
Yeah.
that is what is very, very interesting. And at the end of the day, just one smile from them. So that
Okay.
is what
exactly.
makes me really, really happy.
Awesome. So good to hear that. And I think I should thank Dr. Ekta to come back from the US and you giving, I mean, half of the service you said I've not even heard, like laser dentistry, I have not heard till date. So I think, yeah, that's
Yeah,
amazing. There's a lot of knowledge sharing and you're bringing in advanced techniques to India. Thank you so much. Uh,
Definitely. Yes, yes.
yeah. So the next part is, what's the best part about your job? So I think Isha, I
all.
dealing with kids is probably the best thing
Yes,
about your job.
yes.
So what about you, Ekta?
So I've been in this profession now for about 25 years almost. And as we began, I think I've worked in so many different dental offices, so many places. My age group of patients has been from 3 years to easily 90 years also. So that's been the age span I have worked on. Over time, I realized after having my own kids, I realized that this 3 years type of age group is not for me. I need to start focusing more on the adults. But in this journey, mainly I realized that, like Isha said earlier, it is dentistry is the most feared profession, and that's the fear of pain. So when I introduced laser dentistry in Juhu, basically I wanted to remove this anxiety and fear from the children, from the adults, from everybody. So I think that is my biggest achievement. I feel in a way that I have brought so much confidence and smiles on people's faces because they are able to get a lot of procedures done in a painless manner.
Okay.
So that's one of the biggest things for me.
Okay. I think you should post more about this because we don't really know. I think many people
Really,
like me are not even
yeah.
aware that such procedures are available.
Yeah, yeah, I understand that. And this is the whole idea of doing, we do post a lot on our Insta page. We also do a lot of promotions. We say once people come to us, also we are able to talk to them face to face.
True.
So they
Hmm.
understand that there is a lot of scope for having things done very seamlessly now versus what it used to be so many years ago. And like I said, I've been here long enough to know what we used to do 20, 25 years ago versus what we do now.
I think, yeah, you are going to help a lot of people in a very, very big way because, smile is something like is the first thing people notice. So
Yes,
a
Yeah.
lot of confidence comes from a good smile. So yeah.
absolutely.
Uh,
Absolutely.
yeah.
There
So
was
I
there
think
was a I would like to add something in
yes,
this.
yes, please.
When you said that smile is the first thing people notice, I'm not aware if many people have seen there was a post in between which went
Yeah.
very viral,
Yes.
wherein
Yeah, he had
yeah,
no
wherein
bro.
the
Yeah,
man, yeah, one eyebrow was missing and one tooth was missing. And
Yeah.
trust me, the first thing that you see is that knocked out tooth. You wouldn't see
yeah.
the
Yeah.
one
Absolutely.
eyebrow missing.
Absolutely.
So
So
this is
true.
genuinely true.
Yeah. Um, so as I understood that a lot of new things are coming in, so what is the scope for dental practice in India? And as we know that dental practice, the cost is much lower in India than, for example, USA, because many people, as
Yes.
you know, they come to India just to get the procedures done. So what is the scope for this kind of business? In
So I feel now, in fact, the scope is far more. Also, because now we are creating a lot of awareness amongst the people, and this awareness has started to increase amongst professionals, corporate world, and all the working people, especially about dental hygiene. So also the other issue is that the kids and adults consume a lot of processed foods. So
Hmm.
that has started impacting the dental and the overall health of people. So
Yeah.
our work has increased now, and the scope has, we have to increase the scope of this whole idea of educating the patients and trying to explain to them about diet. Like I know when even children come in, Dr. Isha goes over diet plan for the children because they
Okay.
have a habit of eating a lot of sweets, processed food. I mean, we all eat it. I won't say that we don't, but how to limit it, how to go about um,
Hmm.
consuming less of the sodas and the soft drinks and stuff like that. So there is a lot of scope. And along with that, we definitely, our job is to create a lot more awareness. And we really strive hard to make people aware of taking care of their dental health.
So I think in net for all the dentists out there, there is a lot of scope, right?
Absolutely,
And
there
a
is
lot of work.
plenty. Yes, yes. Lot of work. Yes. So, like I said, more than scope, our job is also to educate people, make them aware of what's good, what is not good, and how to
Yeah.
limit the intake of all the processed foods, especially.
I mean, yeah, at the end, you are in the health business. So, yeah.
Yeah. It's almost like our responsibility to educate them.
So, as you said, this clinic is recent. So, I'm sure there must
Yes.
have been uh, so I think in another words, if I can ask, for a dental business, I mean, you have a state of art facility. So according to you, what is the biggest investment? Like if someone wants to start a business like you or join you,
Yeah.
or even, or just generalizing this for the entire dental community, what is
Mhm.
the big investment in this kind of business?
So I think our heaviest business investment is our state of the art equipment.
Oh,
We have everything which is top of the line in terms of even our sterilization units. We don't just boil the instruments because boiling kills all the bacteria and viruses. I mean, we have a very high temperature machine called as an autoclave, which we put every single instrument in after every patient. But before we do that, there is another machine where we remove all the bacteria. It's called an ultrasonic cleaner. So these kind of things are, we have a whole sequence of sterilization where there are four specific steps. Then we
Okay.
have a big X-ray machine, which is the machine that goes around your head, which is an in-house machine. Everything is digital. Our small X-rays that we take in the mouth, they are also digital X-rays. Our dental laser is probably one of the most expensive investment, but it's one of the most gratifying things because patients love it. We also use a dental microscope to do root canals and other intricate procedures. So the main investment in a dental practice, if you want to start good and if you want to start big, you must invest in good equipment.
Only then you'll be able to give good service.
Absolutely.
Yeah.
It's
So I think
quality work.
there's a response to Mr. Garg after using Lal Dant Manjan. You'll need to visit to the dent. So yeah, good. I think she answered your question.
Is Isha
Yeah.
answering that question as
Yeah.
well?
Yeah. We would be glad to see you after
Because we
using
have to
that lal
remove the
that you
lal
mentioned.
from your teeth.
Oh, that's funny. So yeah, now the last. So we're just winding this off with the last question. So how do you propose to grow your practice? What is your next strategy?
Basically, in this service industry, right, the happiness of the customers and customer satisfaction is the most important thing, which creates the bond between the doctors and the patients. So this
Absolutely.
bond is usually so strong if it is well done that it will always transform into a word of mouth. Then the word of mouth is how people will come to you. I don't believe personally that people will see an Insta post or a Facebook post and think, oh, let me try this. But I would like to say that we have had few people come in through our Google reviews and by checking out our office pictures and our stuff online. That they've just randomly searched us on Google and come to us and then gone back with a pleasant experience saying that now my whole family will come to you. So for us, our biggest way of growing business is customer satisfaction, which transforms into this wonderful relationship. I think, again, from experience, I'm saying, because I have patients where I have treated the children, teenagers, then they've grown up to be these 20-year-olds, then they are dating, then they're getting married. It's so lovely to see that journey from kids to
Awesome.
growing adults, getting married, and then having little kids of their own. It's wonderful. So
So I think this is
that's
true
our
for yeah. So I think this is true for all service business. So even I run a CA firm. So the
absolutely.
same for me. The relationship building really goes a long way.
Yes, very
Yeah.
true, very true. That's what it
And
is.
also, what we believe
Yes.
at Integrated Dental Concepts, Juhu, is that we work as a teamwork, okay, as a team.
Yes.
It's not that it's only one dentist doing everything. We have specialists and professionals for each field of dentistry. So we have an entire team working with us with the most advanced equipments. And also, we are NABH accredited. So that's the the merit that we have. So yes, we do provide the best standard protocols of sterilization, disinfection, cleanliness, and also only a specialist deals with that particular field. Like if you come for root canal, an endodontist is only going to do the root canal. So that's a root
Yes.
canal specialist. If you come with a child, a pediatric dentist is only going to treat you. If you come in for implants, implantologist is only going to treat you. So yes, we have professionals working with us. So that is what builds up our team.
Okay. Okay, so a really good, it was a great conversation, and I hope you continue doing this work. I'm actually looking forward to knowing much more from you. So just to give a gist, so mainly for kids, to use age-specific toothbrushes, to use fluoride, non-fluoride paste, and you said it is between 500 and 1000 ppm, right?
Yes.
Use a fluoridated toothpaste, 1000 ppm,
Fluoridated.
just to make it simple. Fluoridated toothpaste.
Okay. Okay. No, but the initial 1 year you
That's only
should
for
use in on
no.
3 months.
That's only the
Okay.
initial 2 to 3 months just to train your child
All
to
right. All
adapt
right.
that taste.
Okay. And other than that, the tip which you gave me for rinsing the mouth is priceless. I'm really going to try that. So for those who have, please go to the start of the conversation. And and soon as the first tooth erupts, please go to a dentist for your kids and take care of yourself as well.
Yes,
So,
please.
yes.
Yes, very important.
So thank you so much for your time, and yeah, it was amazing.
Thank you
Yes.
so much, Ami. It was lovely
Yeah.
talking to you too.
Thank you.
Yes.
All the
Have a
best.
nice. Yes. Have a
Thank
nice
you.
day.
Good
Bye.
day. Thank you.
Yes.
You too.
Bye.